I was drawn to back pain because it's one of the most common reasons why people seek emergency care. In many cases, people are receiving low-value care or care that's not recommended in guidelines. They may cause harms, including imaging, opioids, and admissions to hospital. That's exactly what we're trying to fix, is to bridge that evidence gap and to improve care for people with back pain. The prescription of opioids have been significantly high in Australia. What we saw is that about 3/4 of people presenting for back pain were receiving opioids, but what was happening next was the real problem. About 1/3 of these patients were still taking opioids after being discharged from hospital, and what we know now is that opioid medicines provide no benefit for people with acute low back pain and may cause significant harms. So our research showed that it's possible to manage people with back pain. A simple strategy to provide emergency department clinicians with additional support and training. We saw a shift in clinicians' beliefs and knowledge around managing back pain in hospitals. They were more confident in using other approaches rather than just relying on opioids. And that led to a significant reduction in the prescribing of opioids of about 43%. Previously, most of the evidence or conversations around managing back pain was in primary care. So that led to new policy and new guidelines. For example, our work has led to the development of the Australia's national low back pain clinical care standards. So the work that we have done initially was focused in New South Wales, but it has now expanded. It's having a great impact across Australia. One clear example of the impact of our work is that in our conversations with our emergency department colleagues, they're still talking about the SHAPE trial and the impact that our work has had on their practice, and that has led to improved patient care and healthcare delivery. So this work really matters to patient safety because it really reduces the risks associated with the use of potentially harmful medicines such as opioids. And what we saw in our work is that reducing the exposure does not compromise patient outcomes. Patients can still recover from their back pain and they're still satisfied with the care they receive. For us, it was never about publications or academic outputs. Was to have an impact on patients' lives, have an impact on healthcare delivery, and improve healthcare systems. I think our work is a good example of what we can achieve when researchers, clinicians, policymakers, and patients and consumers, when they work together to achieve great things. So receiving the Research Action Award, it's a validation of the importance of implementation research. It highlights the importance of the work that we're doing to change practice and to improve patient care.